Hey guys, it's me, Lutropin Alfa. I am a fertility drug if you guys don't know. And here's...
Wait, I'm a Lutropin Alpha. You're obviously an imposter.
What? If you're a Lutropin drug, then...
Good morning, drugs.
Good morning, Mr.
Morning,
L.
Mr. L.
What's the problem?
Well, this I don't know what drug here just claimed that she's me. I think she's high.
Of course not. I am the real one, the original.
Enough with that, you two. Prove it.
I am branded as Luveris based on pharmaceutical company and my chemical name luteinizing hormone and complex with luteinizing hormone. How about you? How do they classify you?
Well, in terms of therapeutic, I am classified as a pituitary gonadotropin or a recombinant luteinizing hormone. In terms of pharmacologic, I am classified as a heterodimeric glycoprotein, which is made up of monomeric units.
What's your pregnancy category?
Category X.
Category X!
Oh, she's a
Lutropin
Alpha.
Alpha.
So you now know each other. Amazing.
Thank you so much, Mr. L. So as I was saying, I have here Luveris with me. We will discuss how we affect the human body, what will the body do to us, what are we used for, our contraindications, our unintended effects that predictably will cause, our undesirable responses, and how nursing should be responsible for administering us to patients. Let's get started! Mechanism of action or how we affect the human body. I, together with Luveris as a Lutropin Alpha, used to facilitate female conception. I perform the same action as luteinizing hormone, which is normally produced in the pituitary gland. We are given together with Lutropin Alpha as we stimulate the development of a follicle to prepare the reproductive tract for implementation in pregnancy. We also stimulate the theca cells and testicular Leydig cells for male to produce androgens and the secretion of estradiol by the follicles. Human chorionic gonadotropin hormone or the HCG is then administered to complete follicular maturation and induce ovulation. We substitute for endogenous luteinizing hormone and induces rupture of the pre-ovulatory ovarian follicle and oocyte expulsion. We also induce and maintains the corpus luteum, which then secretes progesterone. Adenylyl cyclase enzyme then activates many other pathways leading to steroid hormone production and other follicle maturation processes.
So, I am absorbed through subcutaneous administration with an absolute bioavailability of approximately 60%. Then I am rapidly distributed with an initial half-life of approximately 1 hour. My steady-state volume of distribution is about 10 to 14 liters. I am eliminated from the body with a terminal half-life of 10 to 12 hours, and my total body clearance is around 2 liters per hour, with less than 5% of the dose being excreted and changed renally.
We are used for the treatment of infertility in women with hypothalamic or pituitary insufficiency or the hypogonadotropic hypogonadism and profound luteinizing hormone deficiency where their LH is less than 1.2 international units or IU/L. We are also used to stimulate follicular development.
You nurses will give me to your client, you should keep in mind that I have these factors that serves as a reason to withhold a certain medical treatment due to the harm that I will cause to your client. These are primary ovarian failure, the uncontrolled thyroid or adrenal dysfunction, active untreated tumors of the hypothalamus and the pituitary gland, ovarian, uterine or breast cancer, abnormal uterine bleeding, ovarian enlargement or cyst of unknown origin of polycystic ovarian disease, sexual organ malformation, fibroid tumors of the uterus in pregnancy and lactation.
We have also unintended secondary effects that predictably will cause to human body, which is called the side effects. If you must have side effect if we are administered, you should get emergency medical help if you have any of the signs of an allergic reaction, such as hives, difficulty breathing, swelling of your face, lips, tongue, or throat. Some women using me, Lutropin Alfa, and Lutropin, because she is also Lutropin Alpha, develops a condition called ovarian hyperstimulation syndrome, or the OHSS, especially after the first treatment. OHSS can be a life-threatening condition. Stop using me. Do not have sexual intercourse and call your doctor right away if you have any of these following symptoms of OHSS. In your reproductive system, you will experience pain or swelling in the lower abdominal pelvic area, unusual vaginal bleeding, pelvic pain, menstrual cramps, and breast pain. In your EENT, or the eyes, ears, nose, and throat, sneezing, sore throat, slurred speech, problems with vision or balance, swelling of your face, lips, tongue, or throat. For your gastrointestinal tract, you will experience bloating, severe nausea, vomiting, diarrhea. For your systemic effect, you will experience headache, sudden numbness or weakness, especially in one side of the body, chest pain, sudden cough, wheezing, rapid heart breathing, coughing up blood, a sudden rapid weight gain. Adverse effect are the undesirable response in your body. So significantly, it will cause reproductive system neoplasms, ovarian hyperstimulation syndrome, ovarian enlargement, ovarian torsion, thromboembolic acute porphyria attack, miscarriage, abortion, ectopic pregnancy, multiple births, congenital malformations, and thromboembolic events. For gastrointestinal disorders, it will cause abdominal pain or discomfort, constipation, diarrhea, flatulence, nausea, and vomiting. In your general disorders and administration site conditions, it will cause fatigue, malaise, pain, erythema, hematoma, swelling, irritation at the injection site. In your nervous system disorder, it can cause headache. In your reproductive system and breast disorders, it can cause ovarian cyst, ovarian disorder, breast pain, and pelvic pain.
Nurses are responsible in what to do before, during, and after administering me to their client. First things first, be sure to give education and drug therapy for your client to promote understanding and compliance about me. Then assess my causes of dysfunction to ensure appropriate usage. You nurses should also complete an examination to rule out any problems, and the urine, estrogen, and estradiol levels should also be checked to verify ovarian function. I should be administered with an appropriate dose to ensure my beneficial effects. It is also important to provide your client a calendar of treatment days, explanations of adverse effects, and instructions on when intercourse should occur to increase my therapeutic effectiveness. After administration, provide comfort measures to help patient or your client tolerate my effects. Discontinue using me if you will find any signs of ovarian overstimulation, and if this will occur, arrange your client for hospitalization to monitor and support her.
Thank you guys for watching. I hope you guys enjoyed. I hope you guys learned something from us here at Lutropin Alpha Drugs, because we would really appreciate that. Anyways, until our next NGF drug, this is your Lutropin Alpha Drugs now signing off. Bye, God bless, see ya!